Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, in this video we're going to go through some changes that have been made recently to the oxygen administration station for OSCE exam. So this is one of your skill stations. So traditionally for this station you were required to administer oxygen via the non-rebreathe mask, which is the one with the sort of bag valve which we use for high flow oxygen. Recently we've had feedback from candidates taking the exam that they're required to administer the oxygen via other devices. Okay, so don't panic. It's still quite a straightforward station. All you have to be aware of is that you might have to administer the oxygen via a different device. So what devices you're going to have? So they're all ones you've hopefully come across in your nursing practice. So you still might have the bag valve mask, you might have nasal cannula, Venturi mask, which is the one with the different coloured pieces, or a simple mask. So how do we know which one to administer? Well, this is going to be really easy. It's going to be written on your prescription for you. So if you can see here the prescription for the oxygen for OSCE exam, and on the bottom left corner you've got the codes for your different kind of masks, and it will show you there which one you need to use, so just go through it and read that. So let's have a look through it. So obviously this will be available in your exam, so don't need to memorize it. We will go through it now just so you have an idea, but don't need to memorize it, okay? So A is for air, N is for nasal cannula, M is for simple mask, and then you've got several different Venturi options. You've got 3 options, so those are the ones with the coloured pieces. We will go through that a bit more detailed later on. So you've got V24 for Venturi 24, V28 for Venturi 28, and V60 for Venturi 60. And then we've got MVI patient on MVI system, which we're not going to have in the exam, so don't worry. Humidified oxygen, again, we're not going to have in the exam. We might have the reservoir mask, which is RM, and that is your bag valve mask, okay? And that's all of the ones we might, oh sorry, there is more Venturis, so we got V35 for Venturi or V40 for a different Venturi, okay? There's obviously ones for CPAP and that kind of thing, humidified oxygen, but don't worry about that. You're not going to have that in the exam. That's far too complicated for them to test you on in the exam. So obviously, like all our other medication stations in the exam, remember in the OSCE and in general, oxygen should be considered as a medication, okay? So you will be required to do an ID check. I always try and advise candidates to do 2 ID checks. I just think it gives less chance of failing. If you give 2, you're less likely. I mean, even if you do 2 in general, if you miss 1, you've still got another one to do. Okay, on the chart it's going to be marked if the patient is with COPD, a CO2 retainer or not. And then it's going to be charted for the target oxygen saturations. So you're going to ask the examiner what is the target saturations, okay? So obviously the patient's target saturations are going to be lower than their target, or what their target should be. So that's why we need to give the oxygen. So for example, if the target is 94 to 98, you're going to say, examiner, what is the patient's saturation? And she's going to say like 92. So it's clearly indicated we need to set up the oxygen. Okay, next it should say the flow rate and device. So this is going to be how many litres and what device you need to choose. So remember, you can use that the chart there to remind yourself which one it is. And then obviously we're going to check doctor's signature is complete. Okay, so let's run through each of the different devices you might have. So starting with the non-rebreathe, obviously this is for high flow oxygen. On this chart, it is called the RM reservoir mask. So remember, with this one, if you do have this one, you need to press the valve and inflate it before you set it up, and obviously attach your tube to the oxygen on the wall or oxygen cylinder you might have, and secure it correctly on the patient's face, so on the nose and the ears with the straps, and try not to make sure it's being pressed too tightly. Other ones you might have, so nasal cannula. So this one, it will be for low flow rate, and it needs to be no more than 4 litres. It should be prescribed correctly. And remember, we're just going to insert those prongs into the nose and put it around the ears. You can tighten the strap a little bit on the neck, but obviously we don't want to cause any sores or anything. Other one we might have is the simple mask. So this is the mask without the coloured pieces, which we can set to sort of any rate. So this should be ideally 5 to 10 litres. Again, the prescription should be correct, so you shouldn't be having any to check really too much or worry that the prescription is incorrect for this oxygen. Just set it up, attach the pieces together. It's quite straightforward, and then make sure it's applied to the patient correctly, and you've put however many litres is prescribed. I would always say to just verbalise what you're doing. So examiner, it's 6 litres prescribed, so I'm turning the oxygen up to 6 litres. Okay, the other one is the Venturi mask. So this is the one which can be with the different coloured pieces, and you will have the prescription for whichever one. So we're going to say, for example, Venturi 24. So you will have on the packet or on the actual piece for the mask, the coloured piece that you put on the end, it will say V24, so you know which one to pick. Okay, and then it will also give you a number of litres on the packet or on your prescription which you need to set it to, and that's it. So just make sure you've selected the right colour, and then set it as it says on your prescription or on the packet. They both should be the same. Okay, and obviously make sure it's secure, and that is it. Once we've set up the oxygen, we need to obviously chart it on our drug chart. So there you need to put your sign and put your name and date and time, and then it says flow rate and device. So you just use the code and basically put the same as the doctor's put, because that's the same that you will be putting. So whatever it is, if it's nasal cannula, you're going to put N and 2 litres, or whatever is prescribed, you're going to write the same. We do have another video here about the oxygen therapy station, so please have a watch of that one, which gives you a bit more detail about everything. And as always, good luck with your exam.